Now, most Kenyans are not even going to hospitals because of the skyrocketing numbers. So far, we're at 2,021 cases of COVID-19. 5 more people died. That's led to 69 deaths in total, recovered are 482. But Kenyans are now really not going to hospital in fear of contracting the virus. So it's a very worrying trend where the number of Kenyans seeking essential health services has continued to drop. The government has now issued new guidelines aimed at marshalling Kenyans back to the hospitals, as Dorcas Wangira reports.
At the Kisumu County Referral Hospital entrance, there is a semblance of teeming activity, but inside, patients trickle in. The near-empty benches show the situation that is replicated in many health facilities in the country. A drop in outpatient visits in most health facilities. Patient numbers have also reduced drastically in the wards. The question is why?
Watu hawakuji hospitali kwa sababu kuna shida mingi sana. Moja ni kuogopa mambo ya corona. Mimi nimetoka huko Ahero. Ahero ili nikuje district hapa nitibiwe, lazima nitumie pesa na kuna hata hiyo fare.
The drop has been attributed to the restriction of movement and the stay-at-home orders, and the rise of the cases of healthcare workers infected in the line of duty. The decline has resulted in huge drop in revenue, and to stay afloat, most hospitals have had to institute stringent measures to cut down their operational costs, including pay cuts or job losses. The Mater Hospital, in a memo to staff dated 27th May 2020, says all staff will have to take a pay cut for 4 months to remain at an optimal operational level. In a similar communication to staff at the Mpisha Hospital, to meet operational costs and sustain the cash flow commitments, staff will also have to take a pay cut, and some will also have to take leave. The Ministry of Health has given guidelines to reverse the trend and marshal patients back to hospitals. The new guidelines that seek to ensure that essential services are not disrupted include giving vulnerable groups such as children who require routine immunization, reproductive services, people living with HIV, cancer, respiratory illnesses, and non-communicable diseases confidence to visit hospitals by having the health facilities adjust their services and institute health safety measures at the facilities. The ministry also recommends reorganization of patient flow by appointment-based visits, increased operational hours, telephone consultations and follow-ups, longer durations between appointments, and dispensing large quantity of drugs to cover longer periods of up to 6 months. Such measures seem to be working at the Bungoma West Hospital, which had to put in place measures including spaced seating arrangements in the waiting room areas, hand hygiene facilities for patients, and mask use.
It only dropped during the first week when they announced about the social distancing. After 1 month, the patients actually resumed. From around 600, we are seeing around 400 patients outpatient daily. Our renal unit in renal units have never dropped even a single day. Why? Scheduling them.
Dorcas Wangira, Citizen TV, Nairobi.